The COVID-19 pandemic continues to make inroad in some parts of the West as the UK's death toll reaches second highest in the world, while the US continues to peak with more than 1 million infections and 61,000 plus deaths. Still, New Zealand is out of the woods as Prime Minister Jacinda Ardern announced that widespread undetected community transmission has stopped and tough lockdown restrictions will be eased from Monday night. This brings the much-needed ray of hope to a sick world and to us on COVID-19 myths and facts. Welcome to the program. Now, where others have hidden the travel history of their sick family members, we draw inspiration from a father who put public interest above family ties. His son embarked on a forbidden trip amid a lockdown, and his father refused to receive him. This video, now gone viral, is hilarious, but the underlying message is profound.
So, I don't know. Tell me the reason why you forced yourself to come to Ekiti State. After your father have told you that you should return back, what is the mission you have?
The mission is...
Have you already contacted the COVID-19?
No. I didn't have any COVID.
Okay.
I didn't have any virus.
What I will do is, please go and enter your father's, go to your father's car and enter your daddy's car and go to your...
Enter my car. Go enter my car. Let him stay here in this pavilion. And let the state do whatever that he needs to do. And let
Now, the Ekiti State government has reacted to this video clip with its task force commending Mr. Femi Adeoye, that's the father, for refusing to cover up his son's travel history and for denying him access into the house without confirming his COVID-19 status. But the man who filmed the incident is an appointee of the governor and has now been suspended for acting outside the jurisdiction of his scope of authority. There has been a public outcry over the status of the video recorder, who is neither a health worker nor qualified or authorized to determine the health status of the young man. In the meantime, the young man has been taken to one of the designated quarantine centers where he will be isolated for 14 days. His samples will also be tested. Africans in China. Now, videos showing the mistreatment of African nationals living in the Chinese city of Guangzhou became a major feature around African broadcast and social media in recent times. This led to a diplomatic spat between affected nations and China, which threatened to sever long-standing relations. The Chinese ambassador to Nigeria said the issue of a Nigerian who tested positive for coronavirus after returning to the country triggered the many videos alleging maltreatment of Nigerians. On his part, Nigeria's Minister of Foreign Affairs, Geoffrey Onyema, said the government investigated the allegations and found them untrue. But governments pledged renewed commitment to combating the pandemic and bridging the line of communication henceforth.
These cases that had been confirmed as positive that came in from an African flight, and that there was this lady who owned a restaurant and who was positive, and the great fear that all the clients visiting that restaurant and maybe other restaurants might have been infected and might now be passing on that infection. But what our officials in China made clear was that the communication could and should have been better.
Since February 17th, the policy to fighting the disease in Guangzhou has been evolving. And I should say, until yesterday, it has changed 10 times. Why? You have to be precisely attack the virus. We object, we reject any differential practices. We have zero tolerance for discrimination.
Now, 34 out of 36 Nigerian states have recorded a case of coronavirus. How soon before it gets to the remaining 2? Stay with us. We'll be right back. The Director General of the Nigeria Center for Disease Control, NCDC, Dr. Chikwe Ihekwazu, had warned that the COVID-19 virus would get to every state in Nigeria. As at the last count, 34 states had confirmed cases of COVID-19. Cross Rivers is one of the few states without a reported case, and its health commissioner, Betta Edu, is of the opinion that not every state in Nigeria must have a COVID-19 case. This is on the basis that some people in Cross River State are allegedly being promised millions of naira should they claim to be COVID-19 positive.
Be quarantined for 14 days with the required results before they are allowed to come for training or whatever it might be. Because right now, everyone is a suspect. It is not compulsory. And I repeat, it is not compulsory that every state in Nigeria should have a COVID-19 case. People have come to meet the team to show us text messages that have been sent to them, that if they can say they are COVID-19 positive, then they will be given millions of naira. It's gradually getting out of hand.
That was the Cross River State Commissioner for Health, Betta Edu. She joins me now via Skype to talk more about that. Thank you for